about vaccine breakthrough cases. Can you first off explain what that is? And we'll start with that. What is it?
So a breakthrough case happens when you get the vaccine, you're fully vaccinated. So in this case, 2 weeks after your second dose of either the Pfizer or Moderna vaccine, or 2 weeks after your only dose of the Johnson & Johnson vaccine. And we monitor for this with all vaccine preventable diseases. It is an infection after becoming fully vaccinated.
So it is basically COVID after you get vaccinated?
Yes. So, and I want to put in context where we are as a state. So we have been monitoring for this. We've received reports of 102 breakthrough cases from February 1st through March 20th in our state. Keep in mind, 1 million people are fully vaccinated in Washington state. So this is a very small portion of the people vaccinated have had one of these breakthrough infections.
Yeah, and talk to me about like the people that do get these breakthrough infections. Are these older adults? Are they younger? Is it a mix, or is something that we can maybe pinpoint in terms of who's getting this?
We do look at that. I don't have that information right in front of me. I could put you in contact with our infectious epi, who is an extraordinary clinician, and Julie can follow up. What I can tell you is the majority of these breakthrough cases have had relatively mild symptoms. And I think people have a tendency to have concern that this means the vaccine is not effective, which is why I provided that context of how few of these cases have emerged. And on top of that, the CDC released some data earlier this week showing how the Pfizer and Moderna vaccines perform in the real world. And all of these vaccines are continuing to show that they are highly effective at preventing infections and at preventing severe disease in particular.
So what it sounds like, Lacy, is that, I mean, even though you do get the vaccine and it is very highly effective, in some cases 90% effective, there is sounds like a very small chance that you could get COVID. Is that basically what's happening here?
There is still a very small chance you could get COVID, and that chance exists for other types of vaccine preventable diseases as well. So we have been recommending to people who are fully vaccinated, please keep wearing your mask. Please keep taking the precautions that we know prevent and help to slow the spread of COVID-19. We are in this critical point in our response and journey through the pandemic, and we want to come out, we want to stay on the path to recovery and avoid this fourth wave that we're starting to see in other parts of the country and world.